the Ann Arbor Area Community Foundation has an opportunity to invest $13 million for older adults in Washtenaw County. In order to match those funding dollars with the lived experiences of older adults in the county, we decided to conduct a countywide evaluation of the quality of life and social connectedness of vulnerable older adults in Washtenaw County. This evaluation has been a partnership between the Ann Arbor Area Community Foundation, the University of Michigan's Community Technical Assistance Collaborative, and StatCom, a student organization focused on using statistics to help the community. The collaboration was organized through the Ginsberg Center. So with this survey, we aimed to understand how quality of life and social connectedness of vulnerable older adults compared to those older adults who were not what we defined as vulnerable. There are three specific types of vulnerability we were concerned with. So we had zip code vulnerability, financial vulnerability, and the vulnerability based on living alone. We defined those three types as follows. So zip code vulnerability was defined as any older adult who was identified as living in either 48197 or 48198. These were identified as vulnerable zip codes in Ypsilanti because it was known that the life expectancy in these areas is 10 years shorter than the Washtenaw County average. So we were trying to understand if quality of life and social connectedness would be connected to those shorter longevity outcomes. The second vulnerability we were interested in was financial vulnerability, which was defined as any older adult who either answered yes to receiving rent assistance, which was question 9 on the first page of our survey, or answered yes to being insured through Medicaid, which was question 11. And then they could also be identified as financially vulnerable if they checked no to the question asking about whether they had enough money to pay their bills, which was question 13. And so these three questions combined gave us a good idea of whether a person was financially vulnerable without directly asking about income, which people typically refrain from answering. And we were trying to understand how quality of life and social connectedness of older adults was connected to financial difficulties compared to folks who weren't experiencing financial vulnerability. And then the third construct that we had was the idea that maybe living alone would make people vulnerable to lower quality of life or social isolation. We considered folks living alone if they checked yes to living alone, which was question 7 on the survey. We aimed to understand how living alone related to quality of life and social connectedness.
We now look at how the different types of vulnerability we just defined relate to quality of life and social connectedness. This first graph is showing how quality of life and the different kinds of vulnerability are related. So with this graph, we clearly see that older adults with vulnerability, per our definitions, have a lower quality of life. The gray dots on the right show the average quality of life of adults without that respective vulnerability, and the colored dots are for adults with the respective vulnerability. For example, older adults with zip code vulnerability are shown in orange, with an average overall quality of life of 39, and adults without zip code vulnerability are in gray, with an average overall quality of life of 49. The overall quality of life is around 10 points lower for older adults who are either financially vulnerable or zip code vulnerable. The lower quality of life for vulnerable older adults is true except in the case of living alone. Older adults who live alone do not have a statistically significant lower quality of life than those who do not live alone. Once again, we look at the same relationship between vulnerability, but this time with social connectedness. Here, high numbers are more socially connected and low numbers are lower social connectedness. And once again, the gray dots on the right show that the average social connectedness for adults without that respective vulnerability, and the colored dots are for older adults with the respective vulnerability. For example, again, older adults with zip code vulnerability are shown in orange with an average overall social connectedness score of 3, and adults without zip code vulnerability are in gray with an average social connectedness score of 6. We see, as with quality of life, zip code vulnerable and financially vulnerable older adults have lower social connectedness scores than those without that type of vulnerability. For living alone older adults, they do have a statistically significant lower social connectedness than those who do not live alone. However, the difference is not nearly as large as the other types of vulnerability. We now look further into each of the specific types of vulnerability and their quality of life, social connectedness. So basically these next few slides kind of show the exact same thing you saw in the previous 2 slides, except for it just isolates it one at a time. So here we see that we have lower quality of life, again, for the zip code vulnerable folks than those without the zip code vulnerability. And once again, you see that the social connectedness is lower for those who are zip code vulnerable than those who are not zip code vulnerable. We see a similar thing with those that are financially vulnerable. So financially vulnerable older adults have lower quality of life than those that are not financially vulnerable. And similarly with social connectedness and financial vulnerability, we have lower social connectedness for those who are financially vulnerable than those who are not financially vulnerable. And then lastly, for the living alone vulnerability, we see that older adults that are living alone report similar levels of quality of life than those who are living with others. And then older adults who are living alone report slightly lower social connectedness compared to those living with others, but that drop in social connectedness is not nearly as large as it is for the other types of vulnerability.
In the next series of plots, we examine question-by-question quality of life average scores, looking at different groups of vulnerability. So the first line here, the gray line, represents the average quality of life score for each specific question for those that had neither zip code or financial vulnerability. In the next slide here, the green line represents the average quality of life score for those who are financially vulnerable. As you can see across the board, those that are financially vulnerable have a lower quality of life score in every question. Next, the orange line again represents the average quality of life score by question. And as you see, those that are zip code vulnerable, represented by the orange line, has a lower quality of life compared to those that were neither zip code or financially vulnerable. Interestingly, the zip code vulnerability group has a slightly lower score across most questions compared to the financially vulnerable respondents. The most significant takeaway probably from these plots is this red line here, which represents those that were both financially and zip code vulnerable. This is showing the compounding effect that these two vulnerability groups have on one another, in that we have a significant decrease in quality of life in almost every question compared to even those that have a single vulnerability. Similarly, we now look at the average social connectedness score by question in these different risk groups. So again, the gray line here represents those who had neither zip code nor financially vulnerable. The green line once again represents those who are only financially vulnerable, and again we see a lower social connectedness score across each question. Here the orange line represents those who were zip code vulnerable, and we see that the average social connectedness scores are quite similar between the zip code and financially vulnerable groups. In a similar pattern though, once we divide up by patients who had both financial and zip code vulnerability, we have quite a bit of a lower social connectedness average score on each of the 3 questions. Again, representing that there's some sort of compounding effect between these two vulnerabilities. So next, we attempted to use regression trees to separate respondents into different quality of life risk groups. These regression trees are statistically learned, attempting to group similar respondents in terms of quality of life at each of these splits. To use these regression trees, all respondents start at the top of the tree and are passed down the tree based on their characteristics until they fall into what we call terminal nodes, represented by the colored circles here. In our example here, the circles are colored by the different levels of quality of life, high, medium, and low, represented by green, yellow, and red. And at each of the terminal nodes, we give the average quality of life score for those respondents and the number of respondents that fall into that node. So what's interesting to see is that in general, those that were zip code vulnerable and not volunteering had the two lowest quality of life averages. Specifically, those who were zip code vulnerable, not volunteering, and financially vulnerable had the lowest average quality of life score of 35.4. There were 70 respondents in this group. Conversely, those who were not zip code vulnerable tended to have higher quality of lives, specifically those who were not zip code vulnerable and currently volunteering had the highest quality of life score with 50.79. This next regression tree created similarly, but now for social connectedness. The lowest social connectedness risk group were those that were zip code vulnerable, financially vulnerable, and age less than 77.5. Conversely, those that had the highest social connectedness score were those that were not zip code vulnerable and not financially vulnerable. These trees are very useful in that we can start to identify people at risk of high or low social connectedness or low quality of life.
So pictured here is the number, to be clear, number, not percentage, of respondents who mentioned a specific category when asked, what do you need to stay happy, healthy, and independent? That was question 18 on our survey. So these answers are themed. So answers like keep the senior bus running and rides to the grocery store are all grouped under the theme transportation, for example. This chart only includes the top 10 themes. Other themes were mentioned 5 times or fewer. Some examples include English classes, having an advocate, protect immigrants, religious activities, and one was better political climate or government. And then one thing that was not included is I have everything I need at this time. 24 people responded that way. It was not included in this chart because it doesn't provide a clear way to improve and could be seen as a no response, but it's also important to realize that many seniors are getting their needs met in Washtenaw County. And then a majority of respondents did not respond to this qualitative question. So this was not part of our survey, but we wanted to bring in the census data that Adrian Walker at the Public Health Department pulled together. I'm sure many of you have seen this, but we just wanted to make sure that we're connecting the dots between this data and our survey. Since 3 of these regions in Washtenaw County have an average life expectancy for African American folks that is younger than 60, what we know from that is that our survey was not reaching the average, quote-unquote, African American senior in those areas. One implication of this is that services may need to be provided much earlier if we're trying to prevent early death for African American folks in the county and really close this longevity disparity we're seeing. Something else we wanted to mention is that there is some research being done on other issues that might be contributing to this disparity. Margaret Hicken at the Institute on Social Research talks about the effects of race-related stress on health. And her research suggests that addressing racial discrimination and prejudice is key for impacting health and longevity outcomes for people of color. Our survey doesn't speak to this, but we think these suggestions are important to bring in to the conversation as we're talking about how to move forward. So we had some main takeaways from the survey. One was that our measurements for financial vulnerability, answering yes to using Medicaid or having housing assistance or answering no to enough money for bills, was a good solid indicator for financial vulnerability, and it was connected very clearly to lower quality of life and lower social connectedness for seniors. Living alone, on the other hand, did not seem to be a significant indicator of vulnerability. Folks have proposed theories about why that might be, but more research would need to be done to understand whether that really is something that might be contributing to people's quality of life or social connectedness. And then something that I think is very unique to the county and very important is that folks who lived in 48197 and 48198 had a significantly lower quality of life and lower social connectedness than the county average. And that I think is important to know that that's true even for folks who weren't financially vulnerable. And then financial and zip code vulnerability together had a compounding effect on folks' quality of life and social connectedness. Finally, we found some interesting protective factors and needs. So one, and I'm sure no one will be surprised about, is that transportation is a major need across the county for seniors especially. As was mentioned many times in the qualitative responses, and we think it may be an important factor for determining quality of life and social connectedness. And then we may need to be providing services to seniors earlier if we're aiming to prevent early death and close the longevity disparity, considering the census data. And then we wanted to mention that research on the relationship of volunteering to quality of life is continuing to come out and should be reviewed for innovations. And seen here is a link to a journal article released by some researchers at the University of Michigan on the connection between volunteering, motivations, and quality of life.